woke up like this. We flawless. Ladies.
Hi everyone, it's Chloe. I'm back with another video. Sorry this video is really late. I've been wanting to make a video every week, but school's been getting in the way, and school's important. So here I am a month later with another video. So I kind of wanted to make this video today in the midst of finals week, just because it's been on my mind and something happened the other day, actually yesterday, that brought up the topic of this video. There's going to be a couple topics, but they're going to kind of intertwine a bit in this video. So I'm going to talk about being trans and working in healthcare, and how that and surgeries can kind of align in a way. And I know that sounds confusing right now, but I'll try to explain my best and get my thoughts out to make that a little bit clearer for you guys. So, as many of you know, I'm in nursing school, and it's what I love. Like, this is my path, and I know I'm on the right path because it's what I love to do. And every week I have a clinical experience, typically on Tuesdays, and I've been in a cardiac unit lately, and yesterday was my last day on that unit, and every week has been really, really great. The nurses I've worked with have been awesome, except for yesterday. Yesterday, I worked with a nurse who seemed and was very competent in nursing care, but she constantly, every time talking to me or talking to the patient about me, misgendered me. Constantly. She corrected herself every time, but it was constant. It was, oh, she's gonna do this, and oh, this is her first time doing this procedure, or she, like, come on, get it right. Like, misgendering for me it's happened before, and it's something that doesn't really bother me all that much, but yesterday, just the stress of finals and everything that's been going on in my life personally, it just was too much. And this made me think about, like, if this nurse were ever to have a trans patient, how would that make them feel, you know? Because misgendering someone, every time you misgender someone, it's a constant reminder that they're not who they want to be, or the way you view them is not how they view themselves. And it hurts sometimes, and it for sure hurt my feelings. And, she was kind of rude to me in general, but the constant misgendering just wasn't fun. And so this brings me to talk about some surgeries that, I'm thinking about getting. I haven't been super open about surgeries, like, as far as what I want to get. But I know for sure that I do want to get the SRS surgery, which is sexual reassignment surgery, or I believe they're calling it gender confirmation surgery now. But it's something that, is part of my transition. Transition is a different experience for everyone, and everyone has different goals and different expectations of what their transition should be. Some people don't get the surgery, some people do. And I just happen to be, one of the people that wants to get that surgery, among other surgeries. Other surgeries I'm thinking about are a tracheal shave, which is shaving my eaves apple, and I was thinking of facial feminization surgery. I'm not too sure yet. It's not the highest on my priority list. And also a breast augmentation. I think that is probably one of the most important surgeries to me, because it really is going to align my outward appearance with my mental and kind of emotional being. So, I bring up these surgeries and working in healthcare because for me, presenting as female and living as female, because I am female, I want to have that outward appearance. I want people to, not only because I look female, but because I demand people to use female pronouns, because that's what I am. But these surgeries for me, I think, are going to make me confident. They're going to make me, like I said, align my inner self with my outer self and be a better nurse and be a better person. And this sounds so serious, but it is. It's, my life. And these surgeries are really important to me. And I think that by getting these surgeries done, I not only will, I be happier, but in a way, just seeing it all come together, my transition, and it's been a process, and it's going to be an ongoing process, but it's going to make me better at everything I do. And I'm not saying that my life depends solely on my physical appearance, but, in a sense it does. In a sense, my outward appearance and, what I have downstairs is important because it's not, right now, it doesn't align with who I am and who I want to be. And once I'm comfortable with that, I feel like I'm going to be able to be more confident. And that brings me to the topic that I do have a GoFundMe right now. It's GoFundMe, or www.gofundme.com/becomingchloe. And I've had amazing friends and family donate already. And if you're watching this video, I encourage you to donate. Anything helps. And if you can't donate, share my GoFundMe or this video, or and I'll link that down below in the description box. But like I said, I love nursing, and it's going to be a big part of my life, and part of that is being an advocate for people, and part of that is being an advocate for trans people and trans, patients who will be cared for in hospitals and other healthcare settings, because one of the biggest issues right now is people don't know how to, or healthcare professionals don't know how to treat trans patients. And that was evidence, or there's evidence to that by my experience yesterday. No one really understands how important pronouns really are to someone. And the constant reinforcement that I had yesterday with he constantly and him constantly it's just that reminder. It's like, oh, what? It's like if someone were ever to call me my old name. It's like walking down the street, if someone says my old name, it's like I don't even flinch now. It's not, I don't turn around. It's because that's not how I identify. So for someone to say he or him or his, it's not, I don't respond to that. But when you're working one-on-one with someone or one-on-one with a patient, and your nurse or preceptor misgenders you in front of them, not only does that make me super uncomfortable, but it makes my patient uncomfortable because they don't know how to address me. So now, not only am I uncomfortable with the whole situation, but the patient is uncomfortable, and that's going to get in the way of the care that I provide for them. So just being an advocate for trans people in healthcare, working in healthcare, but also trans patient in healthcare is really, I think, going to be a huge part of my life. And for me to dedicate my life to, my passions of nursing and advocacy, I need to feel comfortable and complete. And so this is why I'm asking whoever is watching this video, or whoever is watching my GoFundMe, or watching my GoFundMe progress, to donate or share, because I know that I'm gonna try to make the most contribution I can to other people's lives, starting from now on. I mean, I've already started once I started nursing school, but it's just, I need to feel whole in order to give my whole self, if that makes sense. So I really, really appreciate you guys watching this video and following me on my journey and giving me love, support, and kindness. I really do love you all, and thank you so much for anything you give or do for others. Have an amazing day. I'll come back with a video shortly. I just wanted to give you guys an update. See you soon. Bye.